love to introduce Dove Yu, who's a great supporter of the Society of Tissue Viability, has spoken to us before. And she is a senior specialist dietitian in nutrition support and palliative care at South Tees Hospital NHS Foundation Trust. And Dove is going to talk to us about how important is nutrition in reducing pressure ulcer risk. So really looking forward to this session. Dove, over to you. Thank you.
So, hi everyone. My name is Dove. I'm the dietitian. I'm also a PR officer of the British Dietetic Association at the Older People Specialist Group, and a social media officer at the BDA Oncologist Specialist Group. First of all, I would like to thank the Tissue Viability Society for inviting me to speak at this study day about how important nutrition in reducing pressure ulcer risk. And these are just some of my social media accounts. Feel free to tag me or add me and share your thoughts about this session. So the objectives of the session. We will talk about the link between nutrition and pressure injury development and healing. Then we will look at the current nutrition guidance on prevention and treatment of pressure injuries. And finally, we will look at 2 case studies to develop your skills to give some first-line nutrition advice in clinical practice. A little bit of the background. So Jackie earlier on has already nicely defined what a pressure injury is, so I'm not going to repeat that. But there are 6 different stage categories. So you may see like pain or red wound bed in early stages. When it gets to more severe, bone, muscle, or tendon can be exposed. And regarding unstageable, the basis of the ulcers might cover in eschar in the wound bed. Where deep tissue injuries, you might find some purple area like a bruise, discolored intact skin, and this is due to the damage in the underlying soft tissue. So it is well documented that inadequate oral intake and poor nutritional status are the key risk factors in the development of pressure injuries. And risk factors include malnutrition, nutrition deficiency, low BMI, unintentional weight loss, impaired ability to eat independently, and also swallowing or chewing difficulties, obesity, and dehydration. Our skin needs a good supply of fluids and nutrients to maintain its circulation and keep it supple. While one's oral intake is really poor, not really eating very much, then nutrient supply would decrease with decreasing energy metabolism. And this would reduce the body's ability for maintenance and repair. And being underweight or losing weight, including muscle weight loss as well, can make the bony areas more prone to skin damage, because there is less natural padding, and this will increase the sensitivity to pressure. Obesity is actually one of the independent risk factors of developing pressure injury, which means that if a person is obese but also has a poor oral intake, the risk is actually further increased. And this is because the increase of the weight-bearing load through the pressure areas can occlude the capillaries and decreasing oxygen and nutrient flow to the distal tissue. And often they may have also limited mobility due to large body size and may find it quite difficult to change position. So there are 3 stages of wound healing: inflammation, proliferation, maturation. Each stage is time limited and marked by distinct physiological events, with specific key nutrients playing crucial roles each phase, depending on individual circumstances, health status, and the 3 phases may progress backwards and forwards. So during the inflammation phase, the blood vessels surrounding the injury will contract and form a clot. And once bleeding stops, the blood vessel will dilate to allow those nutrients and white blood cells, enzymes, antibodies, and other needed growth factors to actually proliferate to the injured area. For example, amino acid arginine is important because it is a precursor to allow nitric oxide, which causes the blood vessel to dilate more, open wider to increase blood flow. And this increased blood flow can support collagen growth. So during the second stage, which is proliferation, the pressure injury begins to fill the collagen and other extracellular elements. So this will allow new blood vessels form to develop supplies of oxygens and nutrients to the injured area so that the wound would eventually close. And during the maturation phase, the collagen within the closed injury will strengthen and the skin discoloration slowly disappears. So for example here, glutamine would improve the wound strength and increase the level of mature collagen. So when the nutrient status of the individual is compromised, the healing of pressure injury many times do not progress as planned, so the injury might become more advanced. So I've highlighted some of the nutrients that plays an important role in tissue viability and wound healing. I'm not going to have a deep sort of going deeply around this topic, but you can have a look on the paper. So usually we say having enough energy, protein is really important as well, and vitamin A, B, C, E, K, copper, iron, and zinc are quite crucial. And I've listed out some of the sources over here, but the key is actually having a nutrient dense diet and enough hydration, which we'll cover later as well. And I just want to look at some of the evidence about the link between pressure, ulcer, and nutrition. So there is a 2015 study in Austria found a significant association between pressure ulcer existence in acute settings with people with a BMI of less than 22. And there is also another cross-sectional study in 2017 in Norway found that patients with possible risk or at risk of malnutrition were more likely to have a pressure injury than low-risk patients. And also with this particular study, they also found that those with a BMI less than 20 or ate less in the past week have the strongest association with pressure injury. So this actually very nicely highlighted the importance of early identifications and treatment of individuals who are malnourished or at risk of malnutrition in order to prevent them to having pressure injury development. Then we'll look at some of the current guidance on prevention and treatment of pressure injuries. So what does the guidance say? There are two key guidance that we normally refer to. One is the European Pressure Ulcer Advisory Panel Clinical Practice Guideline 2019, I'm sure all you should be aware of. And also the NICE 2014 CG 179 guidance on pressure ulcers prevention and management. So with the European guidelines, they normally sort of have different clauses to describe the strengths of the evidence, which I'll go through later, just to indicate what sort of quality of evidence they've got for each statement that they recommend. Regarding nutritional state assessment, for prevention, it recommends nutritional screening, assessment, and care plan for a person with pressure injury who are malnourished or who are at risk of malnutrition. Whereas for healing, it encouraged optimizing potential for healing by evaluating nutritional status and addressing deficits for all adults with a pressure injury. It also recommends that nutrition assessment and care plan, but also reassessment if there is no signs of improvement within 2 weeks. So hopefully you might have heard of nutritional screening using a tool called Malnutrition Universal Screening Tool, a MUST tool. So this is a screening tool we use in the UK to identify if we needed dietetic input. So basically there are a few steps. The first step is look at the person's body mass index, which is your weight divided by your height square. And after you've calculated that, and then you will score a 2 if you've got a BMI less than 18.5, a 1 between 18.5 to 20, and then above 20 is a 0. Whereas step 2 is about the percentage weight loss that they've got, and less than 5% is 0, 5 to 10 is a 1, and then more than 10% is 2. And if the patient is acutely unwell, quite ill, and have no nutritional or very little minimal nutritional intake for more than 5 days, then you will score a 2, and then you add it up all score, and then normally must above 2, then you refer to a dietitian. So regarding nutritional requirements with energy for prevention, the 2019 guidelines recommend optimizing energy intake for individuals at risk of pressure injury who are malnourished or at risk of malnutrition. But for healing, they've got specific figure. So it would be providing 30 to 30 calories per kilogram per day for adults with a pressure injury who are malnourished or at risk of malnutrition. But both the evidence is low or moderate. There is more specific guidance for prevention, and this is likely because the energy requirements varies between different clinical conditions, and we mostly rely on studies conducted in different patients group to determine energy need or protein needs. So that's why it's quite challenging. In terms of protein, they recommend for prevention to adjust protein intake for individuals at risk of pressure injury who are malnourished or at risk of malnutrition. Whereas for the healing, to provide 1.25 to 1.5 grams per kilogram per day for adults with a pressure injury who are malnourished or at risk of malnutrition. And for those maybe having sort of multiple pressure injuries, the protein requirements can go up to 2 grams per kilogram per day. But we need to also pay attention for monitor changes in renal function, hydration status. But you can see here, the evidence in protein in healing is quite high. So it's definitely important to consider that when giving our advice. So what about timing of protein? Does it make any difference? So this is a graph showing the protein distribution at meal times. So we have got breakfast time where the person actually skip breakfast and having a light lunch and a heavy evening meal. So we've got menu 2 where we have got equal distribution of protein at each meal time. And we've got menu 3 where we've got light breakfast and then a light lunch, but a very heavy evening meal. And what do you think? Which menu do you think would have more sort of produce more tissue synthesis or protein synthesis? If you can put it in the chat about what you think, that would be great. I can see some answers about number 2. 2, 2, 2. 2. We've got plenty of 2. That's brilliant. So the answer is 2. So equal protein amount at each meal time would provide, actually, there are several studies show that equal distribution at each meal would provide the level of leucine that you would need to trigger the tissue synthesis pathway to promote it. Having extra protein at one meal actually give you no more tissue synthesis because our body would get to a saturation point. So majority of the studies showing about 20 to 30 grams protein per meal may be effective. However, the exact amounts can be quite controversial. So what is 20 to 30 grams of protein? If you can put into the chat and maybe type something that you think would be about 20 to 30 grams of protein. And then I will show you a table that I've made with regarding different plant protein and animal protein with different protein content. Or maybe think about what did you have for breakfast this morning? We've got 2 egg omelets with cottage cheese, chicken breast, peanut butter, eggs, high protein yogurt, tin of tuna, boiled eggs. Can anyone guess how much protein would 1 eggs provide? If you can type into the chat. 8 grams. Wholemeal wrap, chips and tomato. 6 grams, 100 grams of chicken breast, 10 grams. Porridge. 18 to 20 grams. Right, we've got different answers. So 1 egg is usually about sort of 6 to 8 grams of protein, depending on the size of the egg. So I can see someone mentioned about tin of tuna, which is correct, is about 24.7 grams of protein there. I think someone mentioned about porridge. Unfortunately, porridge is quite low in protein. The protein that you can get from porridge mainly from milk. So about 250 mils of milk. Well, normally in a porridge portion, you might only get sort of 7 grams of protein. So this is a list of protein. So I typically, my own meal would consist of like a protein, like a piece of chicken breast, or like a tin of tuna, or like 3 eggs, because that's about 21 grams of protein, and mainly because there are low in calories but high in protein. And as you can see here, animal protein has a relatively higher protein content than the plant protein, so you might rely more on like beans and pulses, soya for the plant protein. Right, so let's move on. Right, so going back to the guidance, so regarding nutritional supplements, for prevention and healing, it recommends to offer high calorie, high protein, fortified foods or nutritional supplements in addition to usual diet, only if the nutrition requirements cannot achieve by normal dietary intake. And for healing, it also recommends to provide high calorie, high protein, arginine, zinc, and antioxidant oral nutritional supplements or enteral formula for adults that with a category 2 or greater pressure injury who are malnourished or at risk of malnutrition. So the oligo element soil trial, which is a study, support this recommendation. In the UK, unfortunately, there is only 1 product sort of called from Nutricia called Cubitin, which is shown in this picture, that sort of containing arginine. But this is actually not a CBS listed from the prescribing. And there's only 1 study to support this product, which is also funded by Nutricia. And these are quite expensive as well. And NICE guidance also recommends that do not offer nutritional supplements to treat a pressure ulcer in adults whose nutritional intake is adequate. About hydration as well. So there is no specific fluid requirements, and the European guideline recommends to provide and encourage adequate water fluid intake for hydration for an individual with or at risk of pressure injury, which when compatible goals of care and clinical condition. This is a Pench book, which is the Bible of dietetics, and it suggests fluid requirements to be 35 mils per kilogram for adults who age 18 to 60 years. Above will be 30 mils per kilogram. So regarding vitamins and minerals, there is no specific requirements there. And because there is basically not enough evidence to support consumption of megadose of micronutrients to assist healing or prevent pressure ulcers. Normally, if you're eating quite a balanced and very healthy balanced diet, then you'll be able to get all the nutrients that is enough to support wound healing. And this is a food fact sheet from the British Dietetic Association that myself and also Alison and Elaine from the British Dietetic Association, or the People Specialist Group, right? So everyone can access it. So basically, if you type on your Google on BDA, food fact sheet, and prevention management of pressure injuries, and this can be print off and give it to your patients. So mentioned about a varied and balanced nutrient-dense diet is important. So each day try to consume a variety of food groups. So carbohydrates, at least one at each mealtime, your protein source, which we covered just now, and also dairy products, and at least sort of 5 portions of a variety of different types and colors of fruit and vegetables. So we always say eat a rainbow. And the latest evidence, there is a review in this year actually about nutritional intervention for preventing and treatment of pressure ulcers. I'll recommend you to have a little read. So just to summarize that, it says compared to standard diet, there appears to have no difference in pressure ulcer development with the use of energy, protein, and micronutrient supplements or protein supplements. And evidence is really very uncertain about improved healings of pressure ulcers with the use of disease-specific supplements, although it's sort of suggested that energy, protein, and micronutrients, protein, arginine, zinc, and antioxidants, or arginine and micronutrients and collagen supplements may be better than the standard diet alone for healing pressure ulcers. But overall, we've got very limited data and evidence to suggest that. And there is actually no study investigate the effects of food-based approach on pressure ulcer incidence or healing. But in research setting, which is very difficult to conduct because it's very, we've got a big variation on what people's diet is. So just quickly, 2 case studies before we finish. So the first case study, an 89-year-old man with dementia living in a care home, admitted to the hospital with reduced oral intake, reduced mobility, and increased shortness of breath with chest infection. He has some chewing difficulties, has been sipping milk throughout the day. His weight was 65 kilograms, and he's got a BMI of 16 kilogram per meter square. He lost about 10% weight in 3 to 6 months. What do you think is his MOS score? Hopefully there are some nurses in this course that could answer that. And what sort of nutrition advice would you give him on the ward? And this is a food record charts that we've got from yesterday. So he had some half of his porridge, lunchtime managed some jacket potato and cheese, about a quarter, and then managed all jelly and ice cream. And for tea, manage most of the soup and half of the yogurt. If you can put it into your checkbox with the MOS score first, and then have think about the nutrition advice, and you can also put it in a checkbox. I'll give you a few minutes for that. Thank you. We've got the first answer for Jessica. MOS of 4. I'll wait a few more answers, then I'll show you. We've got 3. Too much sugars in that food chart. So we've got 3, 4, 5 with must. So we can move on to what sort of nutrition advice would you give him on the ward now? If you can type into the chat box. Eggs and bacons. Needs more protein. porridge with cream, full fat milk, needs increased protein intake like fish and cheese, more calories. Oh, Jessica just said change her answer to 3. We'll talk about that later. High protein based food, including plant and meat options if able. Fortified diet, chicken with vegetables, potatoes, pureed diet, supplements, glass of full fat milk. Brilliant. There are lots of good ideas over there. So, right. So let's have a look. And someone mentioned about speech and language therapists. That's a good call. With regarding in the must score, so Jessica, you were right for your first answer. So it's actually 4 because the BMI was below 18.5. So that will add up as a score of 2. And second step is about percentage weight loss, which is more than 10%. So that's 2. And acute disease score, he's still eating a reasonable amount, like half or maybe a little bit less. So he's actually not classified as acutely ill and likely to have no or little nutritional intake for more than 5 days. And because I mentioned that he's got dementia, I'm not sure, different hospital, but our hospital got a forget-me-not card where you can find the dietary preferences and like and dislikes. So actually on the card, it says that he likes softer foods and sweet puddings and milk as well. So I can see a lot of people saying like high protein, high calorie diet, and some also mentioned about sort of softer like speech and language therapist referral. So in terms of porridge, yeah, put extra cream to it and use full fat milk, and maybe consider trying a soft diet to see whether actually you will be able to have a bit more. And that's more from a protein and calories point of view, adding extra snacks, but also thinking about how to make it more nutrient dense about vitamins and minerals. So for example, mixing some food puree with some milky puddings. I know there is a comment about there's quite a high sugar level in terms of what he was having. When you're increasing your protein or fiber as part of a meal, if you're having sweet things, actually that is quite good in terms of like your blood sugar control as well. And also if you make sure that you increase the protein to like 20 to 30 grams per meal, that's actually quite beneficial, and regardless if it's sort of sweet based as well. So snacks wise, like on the board, things like Greek full fat yogurt, rice pudding, custard build up mousses, and or maybe asking family to bring in some of the snacks of his preference. And then because he was sipping milk as well, make sure that he is having regular glass of milk, and maybe try some water level milkshakes as well. And if this is not working, then probably worth to try some prescribed nutritional supplements, and also fluid. It's quite important as well, just to make sure that so his fluid requirements would be around 2 liters. So that's for prevention. Next case study 2. So a 75-year-old lady with lung cancer, also type 2 diabetes on metformin, was found with a grade 3 pressure injury at the sacrum by a district nurse at home. Her weight was 55 kilograms. She's got BMI of 19. She lost about 5% of weight in 3 to 6 months. She's got a really poor appetite. She's got a carers twice daily. She was drinking about 5 mugs of black tea and a mug of water. And this is her diet history, a typical day of what she's eaten: 1 Weetabix with semi-skim milk, 2 slices of toast with butter marmalade, and a ready meal. And what basic nutrition advice would you give to carers and this patient to promote wound healing? So you can put your answers onto your checkbox about the nutrition advice that you will suggest based on this diet history, like typical day of diet history. Change semi-skimmed milk to full fat milk. increase protein. Change to higher protein meals, breakfast, lunch. Nut butter instead of marmalade. That's a good idea. Fresh cooked meal rather than ready meals. Right. I'm just cautious of time, so I'll just move on. Thanks for all the ideas. So remember when I talk about the European guideline in 2019, I said it's about for energy requirements 30 to 35 calories per kilogram. So using her weight, I've estimated what she needs for her energy and protein and her fluids. So some people said that swapping her milk to full fat milk, yeah, that's one idea. And what you can also do is you can fortify the milk using some dry skim milk powder that you can get from supermarket like Marvel in the old days. And so that's skim milk, but you're using full fat milk, so that's fine. And there's also a brand like Nestle. The milk powder is whole milk powder. It's called Needle. So that again, it's a very good way of adding extra calories and protein there. And I mentioned about nutrient density. So we also want to look at more protein as well. So maybe as a snack afterwards, maybe a boiled egg or something, just to make sure that that adds up around 20 to 30 grams. And some fiber and vitamins and minerals, like for example, fruit, that could help. So milky drinks, you can offer some homemade milkshakes, things like Horlicks, Ovaltine, and hot chocolate. They tend to add with vitamins and minerals. So if you made up with full fat milk and some milk powder, actually it's equivalent to a supplement drinks like Complan that you can get over the pharmacy counter. And some people mention like more sort of protein. So for example, swapping toast with peanut butter would be a good suggestion, but it might still not be enough. So maybe thinking about like a meat-based sandwich or fish-based sandwich, and then try to offer some desserts or like snacks in between meals that is high in protein. And with regarding some comments about the tea time meal, like fresh cooked meal, actually some of the ready meals also got quite a good nutritional values. So yeah, and then just a good comment from Helen as well. Carers won't make her hot meals from scratch, so looking at alternative ready meals if possible. So it's about checking the labels of and sort of trying to liaise with families as well. So we usually tend to, I would say, like more than 400 calories and more than 20 grams of protein of a ready meal would classify as a nutrient dense ready meals. And in Wiltshire Farm Foods, it's a meals on meals company that deliver ready meals that's ready made. They do like extra mini meals that is like smaller portion, but they've got like 500 calories with more than 20 grams of protein. So that's a good one to have as well. And then I've also included, she's type 2 diabetic. So we normally focus on more fat, more protein. So sometimes we'll say like vitamin C, like high in vitamin C and things like that, like orange juice and things like that. So maybe try things like add the vitamin soft squash, and then maybe try to encourage adding fortified milk into their tea or hot drinks. So this is the recipes that I've just sort of mentioned, how to make the homemade milkshakes that is equivalent, similar to like Complan or nutrition supplements. And I've just pull in some high protein, high calorie nutritional supplement options, how much per bottle over there, which is quite pricey. And then also some of the high protein, low calorie supplements options over here. And these brands usually use collagen and whey protein, but they are quite expensive. And it might be more useful for those that may be actually quite higher in body weight that requires more protein, but not to increase their calories intake, because that might increase their weight and increase pressure and therefore might impair wound healing. So just finally, my take home message. patients who are at risk of malnutrition are more likely to develop pressure injuries, and early screening is vital for pressure injury prevention. Good nutrition makes a big difference and is part of both prevention and treatment for pressure injuries. Good care planning and communication are needed, and more UK data on the prevalence of pressure injury in people at risk of malnutrition and high quality randomized control trials on the effect of these nutritional intervention for wound healing are required. Nutrition is actually everyone's responsibility, so we should all work collaboratively in a multidisciplinary team approach to make a difference. And thanks for listening. These are just some of the reference. And if you've got any questions, feel free to leave it on the chat box. And again, this is my social media and contact details. And I've just got a quick Slido. If you can also put in that and give just a very quick 3 questions on what do you think about this and what would you like to know more, that would be great. I can see some people already put some answers in, so I'll just wait for a few minutes and then I'll have a look on the chat box to see if there is anyone who's got any question.
Yeah, there's mainly sort of, obviously you've asked all those questions, and I'm just scrolling up because I know there was a question closer to the top. I think Helen asked about what you'd suggest if we have no recorded weight from 3 to 6 months ago, or if a recorded weight is over 6 months. So there's no comparison, maybe recent comparison.
If there is no recent comparison, I normally would tend to ask the patient or the family, have you recognized any change in clothes size? Is it looser, like your watches or like jewelries? If you look at the BAPEN website, BAPEN, which is an organization like to produce the malnutrition awareness too. So they've got some guidance in how to actually doing like a subjective assessment if you haven't got actual recorded weight. And sometimes depending on where the patients and what sort of settings you're working in. For me, like I always stick out the patient's weight from like our community system, which is system 1, and also got access on the inpatient system, looking through all the previous admission. And for example, if the patients actually live in a care home, I usually would ring the care home and ask them, and ring the GP as well to ask them. If not, and I will ask some subjective questions like what I've mentioned just now to see whether they have got any difference, or even asking, is their portion size what they're having now, is it the same as previous about 3 to 6 months ago, or is it actually been reducing? And have you been looking if they actually got any wasted like food waste in the bin, and just checking, because sometimes with some of the elderly patients they might forget to eat, and if they've got dementia as well, it's quite high risk of them if they haven't got anyone at home as well. So it's just really worth to check it. Thanks for your question.
Yeah, there's a comment really around supplement drinks, and they don't always taste great. And I suppose that's why we should always try and fortify what they might like rather than use supplements, isn't it? Because they don't always taste great.
Yeah. So we, as a dietitian, we generally really want to promote more sort of food first approach. So that's why there's a big varieties, and food is not just about providing nutrients as well, it's also enjoyment. So, and sometimes you can mix and match with the supplement drinks, adding into food, or like diluted with milk as well, if it's like for example 46 compact protein, which is quite common use in terms of the supplements. And some of the products, there is one called Ultrapan Compact in a little carton that you can actually freeze up, and if you cut it on top, it will become like a lollies, so like a milk lollies. So there are different ways to use the supplements, and there are a completely wide range of varieties. So there are milkshake base, there are puddings, which is like a little custard pod, and there are also soup, which is like a powder mixed with water. There are smoothies, sort of like plant-based. There are it's mainly sort of soya-based, fruity-based, and there is another plant-based forti soup as well. And there are also some powder that you can add into food and drinks. It's neutral flavors, and there are shot style supplements that you can drink, quite high in calories and quite high in micronutrients. And there are also, I showed you earlier on about the sachets of the pro sauce. So it's high in protein, lower in calories, that you can take it orally. So it's about how you make your creativity and how you educate them as well. So, and sometimes it's like an experiment as well with different things, because each individual's their taste preference can be quite different. Thank you.
Dove, I know when you, in the case studies, both the case studies involved how you can add protein, particularly protein, to diets, and it was mainly animal based. I know there's a changes in the way that people are often plant-based, vegetarian, vegan. Can you give some examples about how, because I know the protein value is lower in plant-based proteins, so you probably need more of to get to the level that you need. Can you give some examples of what maybe could be used to try and increase that protein level?
Yeah. So when I showed that milkshake recipes, actually there is a vegan versions that we've also developed. So you can use soya, high protein soya milk, or the soya milk that is actually for kids, because there are added extra vitamins and minerals as a base. And then you can you can add sometimes some people might add some pea protein powder to make shakes. And then on the Vegan Society website, there is a section about vegans of protein sources as well, which is quite useful. And normally I would suggest them having, like, for example, Alpro soya yogurt or any other types of soya base. In terms of almond or oat or coconut, they're relatively lower in protein as a plant alternatives. So we normally would encourage to have soya. And that's the reason why the powder that made actually is from soya as well, from the supplements company. So other than that, would be trying to, for example, pasta, you can use lentil pasta. And there is also buckwheat as well. And there are, so lentil, the different beans, they normally would have different pasta. And usually you can find it on the gluten-free section as well. And actually a portion of that can give you 16 grams of protein per a pasta portion. So compare with standard, which is roughly about 8 to 9 grams of protein in a pasta portion. Actually, you can easily hit the 20 grams of target for each meal time if you're vegan or vegetarian. And then vegan cheese as well. I know some people might say that it's quite expensive. It is expensive. I tried vegan diet for myself for like a week or two and see if it makes any difference. It's sort of difficult to do it. I think it's about your knowledge of knowing what's available there. So I really recommend if you can look at the British Dietetics Association website and also the Vegan Society website. Thank you.
Thank you so much. There's no other questions that I can see, just lots of really positive comments about the presentation, Dove. So I'm going to draw it to a close there. If you wouldn't mind, stop sharing. And thank you so much again for supporting the Society of Tissue Viability. From what I can see in the chat, everyone's really enjoyed that. Very important topic. So thanks again for that. Thank you.
Thank you very much, Sarah.